benefit of PGT is that only healthy and chromosomally normal embryos are selected. So your second question looks at the endometrial thickness and its receptivity. In order for implantation to happen effectively, the endometrial thickness has to be anywhere between 7 to 14 millimeters thick. If the lining is too thin, let's say 6 millimeters or less, implantation simply will not occur. The endometrial lining may be considered as not being thick enough for the attached embryo to be able to continue to grow and thrive. A thin lining will lack adequate blood flow, nutrient, and adequate structure for strong and good implantation to occur. Now, ladies, this is what is really important for you to know and be aware of, and make sure that this is actually done and observed for your next IVF cycle. Did you know that it is very possible for you to be able to work out when your endometrial lining is at its best for implantation to actually occur, or rather I will say for you to have an increased chance for implantation to occur? Yes, it is possible. And that is done by working out the endometrial receptivity analysis. It's actually a way of working out your own personal window of implantation. So essentially, ladies, what you must do for your next cycle is make sure that you sit down with your fertility specialist. Pay extra if you must, but make sure that that window of implantation is worked out for you, because that's going to be the best time for the embryo to be transferred. So now that you know this, for your next IVF cycle, do not turn up at any time, any random time that your fertility doctor will tell you, come and embryo transfer will happen. No, 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 no. You will be asking your fertility specialist, did you do the ERA? And did you work out my window of implantation? Why is that important? God forbid that this next cycle also fails. At least you know that you have ruled out anything that could have potentially be avoided. Yes, it's possible to avoid poor implantation because of a thin endometrial lining. Did you know that it is possible for your fertility specialist to work out if your endometrial lining is too thin? Yes, just by doing an ultrasound scan. So if your fertility specialist identifies that your endometrial lining is too thin, it will be a dreadful error. In fact, I will consider it as possibly even neglect, especially if your fertility specialist knows that you have suffered multiple IVF cycle failures. It will be horrific for him or her to allow transfer to happen when they know that your endometrial lining is thin. There are medications that they can give you to thicken up your endometrial lining. So once they've worked out your ERA and they know your window of implantation,